can assure you that there is a huge difference between knowing about something and having to experience same. So we have few people that will be sharing their testimonials with us. So let's take our first testimonials from Queen Oyekwere. Are you here, ma'am?
Yes, I am. Good afternoon, everybody.
Good afternoon. You're welcome, ma'am.
Thank you. My name is Queen Oyekwere, and I'm a fibroid survivor. And I was diagnosed when I was 24. That was in the year 2014. I was having abdominal discomforts, and I just decided to go for a pelvic scan. And it was discovered that, then I discovered that I had fibroids. And ever since then, I just started researching, because the doctor told me, oh, they're small, and that my only solution as at that time to get rid of it was surgery. And on hearing the word surgery, I got really, really scared. And this made me just go online to start to research about ways I could manage the symptoms. And, that was when I discovered, how diets could help me improve my outcome. So I started juicing very religiously. It became like an important part of my lifestyle, which actually inspired me to go into the juicing business, because I saw the health benefits that it offered me. Between 2014 and 2019, my symptoms were, I could manage it, the menstrual, I started experiencing negative symptoms from 2019, when I think my stress level actually went up. And no matter what I ate or drank, the symptoms were just really, really bad. And, it got to a point I was dreading my period. So it was the year that I followed the rule when it comes to eating healthy. So people that know me, they know that I'm a fit fan. I'm a fit fan. I exercise. I do a lot of yoga. But, the stress I was going through as a result of, running a business and then, attending to all those plenty customer order just made the whole thing, no matter what I did, the symptoms were really terrible to endure. So that was when, it was the 4th annual seminar. My friend told me about it, and then I registered to attend the seminar. Then I heard other survivors share their story. And it was then the long-term fear I had about surgery was dispelled. And I decided to take the courage to go for the next treatment option. And it was a good experience because I didn't want to just go to anyhow doctor to operate on me. I wanted a doctor that know what they are doing. And just listening to the doctors explain in the simplest form what fibroids was all about that year, November of 2019 really, really helped me. And then the fibroid survivors shared their story. It gave me the courage to go for that option. And I would say that seminar of 2019 was a life-changing one. And that's why I took up the invitation to speak, because I know the power of, sharing, a patient sharing their story, because the fibroids topic is a taboo topic in this side of the world that we're in. And, going through the surgery was smooth. My experience at South Shore, I checked myself in, and the thing is this: at South Shore, they have a plan. So you are not just in the hands of people who are clueless about what they are doing. They have a plan, and that really made me to feel more relaxed, you know, during the 4 days that I spent at the clinic. It was a good experience, and so my recovery from, you know, surgery was also very, very smooth. They checked up on me. Their customer care representative, you know, they kept calling me to, you know how I'm doing, and, you know, if I needed anything. And then this is 1 year, going to 2 years actually, that I did the surgery, and my period has greatly normalized. No more painful period, no more heavy bleeding, no more depression, because Dr. Mary mentioned it about depression. Fibroid can cause you to be very, very depressed, and if you don't take charge, it would be that you're not just dealing with your fibroid symptoms. It would be that you're now dealing with two demons, which is fibroid symptoms and depression. And this is not nice. It's not a good thing for a woman to go through, because, you know, your quality of life will just keep going down. And the problem is just fibroids, you know, not treating, you know, the fibroids. So there are many treatment options available for women, and they can explore that, ask the right question, and don't go trying different remedies just because you're trying to find treatment for the fibroids. There are many things that, you know, people throw at fibroids patients online. You know, take these herbs, take this, take this, that, all those things. You know, there are no scientific backing to those things, and you may be delaying your deliverance date by so doing. I just wanted to read, you know, some things that most medication or supplements they contain. Is a statement that they put out there for people who are, you know, for people to know, and it says, you know, when you buy a product or anything, they'll tell you, oh, it can heal this, it can cure this, it can, you know, it can do a lot of things. But, you know, most of these supplements or whatever medications, they put it out there that these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Keep out of reach of children. If you are pregnant or breastfeeding, consult a doctor before using this product. If you are taking any medication or have any type of medical issue, consult a healthcare professional before using this product. So, you know, it's out there. Don't just keep throwing things at yourself. Because I'm saying this because I tried a lot of things. Not just, I tried a lot of things between those years that I was suffering, you know, just to shrink, help shrink the fibroids. But all those things, I think it's just a delay. They are all delays. All they do is to delay your deliverance date. Just make sure you speak to your doctor about, you know, your treatment option and the best treatment option that you can that can be given to you, and, you know, just go for it. There's nothing to be afraid of. I went the surgical route, which was I had an open myomectomy, and within a month or two, I was back on my feet, and, you know, my quality of life has greatly improved, and I'm so grateful to be fibroid free. And that's why I feel the need to come on here and share my story for you, for the fibroid warriors. And there's definitely light at the end of the tunnel. If I was able to, get free of the fibroids due to CAN. Thank you very much.
That's really inspiring. Thank you so much, Queen. Thank you. So we'll be taking our second speaker, Miss Idongesit Dominic, as she gives her testimonials. Are you here? Hello, I can hear you.
Okay.
You're welcome, ma'am.
All right, thank you. Hello, everyone. So I'm a fibroid survivor. I was diagnosed with fibroid in 2019, and it came as a blow to me. I never saw that coming. So, but then it was during a routine examination that I was told by the doctor that, oh, I had uterine fibroids, but she told me that it was 3 centimeters then, and that it shouldn't be of any issues for me. So, you know, I just went about my life. But I noticed that some few months after that, my period started getting heavy. My period started getting so heavy that I had to even switch from the regular sanitary pads. I had to be using diapers because it was that heavy. I couldn't go out. I couldn't go to work the first 2 days of my period. And so it was a very depressing time for me. And I was told by the gynae, because I kept seeing different doctors, and the recommendation then was surgery. That I had to have surgery to get the fibers out. But I just had the fear of, you know, undergoing surgery because I'd never been under the knife. So that fear of, you know, something going wrong. And I remember the first gynecologist I spoke to, I asked him, okay, what are the risks of me having this fibroid and this operation, sorry. And he told me that if I bleed excessively on the operation table, he's going to have to take out my womb. And I was like, I was just 28 years old then. I was like, how can I be having this conversation? So I think that put a lot of fear in me, and I just removed the surgery option from my mind. I wasn't going to go that route. So I started dieting. I changed my diet. I took some herbs that were promising to shrink the fibroids, but my fibroids just kept, the symptoms just kept getting worse. At the time I was diagnosed, the doctor told me it was 3 centimeters. But like with the dieting and the herbal remedies and everything, the fibroid now became 7 centimeters, and my symptoms kept getting worse. The bleeding kept getting heavy, and then eventually I had to have a blood transfusion because my blood level was really low. So it was after I had that transfusion that, you know, I made the choice to do a lot of research to find out more about the options I have as a fibroid patient and to make an informed decision. So yeah, so I found out that there are minimally invasive procedures that can be done to remove the fibroids. I didn't have to go for the surgery. I had the option of not going for the open surgery. So that was what led me to South Shore Women's and Children's Hospital. And then I had a conversation with Dr. Alabi, and he asked me to run a lot of tests, ultrasound, MRI. And then at the end of it, he told me that for the location of my fibroid, my type of fibroid, which was right inside my womb, he recommended that I do the open surgery. And Dr. Alabi actually explained a lot of things to me. He told me that, first of all, there are so many things that can be done, you know, during the operation to ensure that a woman doesn't lose so much blood to the point that her womb has to be taken out. So he told me of different things that can be done, you know, to prevent that from happening. And I think that just dispersed a lot of fears that I had. It really dispersed a lot of fears that I had. And I had the courage to, you know, undergo the surgery. Somehow I was hopeful that everything will be fine. You know, after the consultation with Dr. Alabi, I was sure that, you know, everything was going to be fine. And, you know, from the manners of the nurses, you know, the doctors, I just felt at ease. I felt like, okay, I'm at a place that, you know, the doctors and the nurses, they really know what they're doing. I felt like I was in good hands. So, you know, I was booked in for surgery. I had the open surgery done September of this year. So that's like 3 months ago. And honestly, after I woke up, I just remember thinking, like, so what was all the, you know, the fear about? What was all the fear about? The whole procedure wasn't terrible at all. You know, even days after the surgery, the pain control, I was barely feeling anything. And, you know, I was discharged 2 days, you know, after the surgery. I went home, and, you know, in a few days I was up and about, and, you know, people around me didn't even know that I had gone for an open surgery. You know, it was that easy, to, in quotes. So yeah, so after the surgery, my recovery was fast. You know, I noticed that with my first and my second period, the bleeding greatly reduced. I didn't have to be using diapers like I was. And then I wasn't seeing clots anymore in my period. It was just, you know, blood. And I was like, is this the life I'm supposed to be living? Like, so yeah. And then, yeah, so it's been great. And I just wish that I had been informed earlier on. When I was first diagnosed with fibroids. I wish I had taken an action then. I really wish. So I'm happy that this kind of program is, you know, ongoing for women to be educated about, you know, fibroids, and for them to know that it's not as bad as it seems, and that there's light at the end of the tunnel. You just have to, you know, do your research and make that decision to, you know, do something for your health that has been scientifically proved. And yeah, so I'm really happy to be part of, you know, this program. And I just want to encourage any woman out there that is struggling with fibroids, that there's hope. There's hope. And then if you can just, you know, come out of that fear of surgery or whatever it is the doctor has, if you can just come out of that fear, you know, the battle is already won. If you can just overcome that fear. And South Shore is a place where a lot of information is given and explained, so that you can make an informed decision on what you want to do. So yeah, so that's my story. I hope it encourages any woman out there. And yeah, thank you so much.
Thank you so much. Thank you so much for that inspiring story. I'm sure some people have one or two to take home. Thank you. Okay, so it's raffle draw time. I'm so excited. So at this point, we are going to be selecting the 10 lucky people to be given special gifts from one of our partners, Pink Divas. And so to ensure fairness, we have carefully wrapped all the names of those who registered for this event and placed in a box. 10 papers will be picked, and the lucky names on these papers will be announced winners. Are we ready?